Hi, Griffy. Good to see you. Look at this. This is very fancy. Let's get going. So we're trying to get his legs underneath him a little better. He's definitely holding them in a better position. There you go. Good boy. Man, he can truck. Griffin had a serious neck injury and came out of the surgery paralyzed in all legs. And so when I first met Griffin, he couldn't even hold his head up.
The progress, while it's very slow, is pretty dramatic for us because we know what he was like before.
I'm going to hold him in the back.
With neurological dogs that don't have any use of their extremities, we use techniques that promote the nervous system to facilitate muscle contractions. I do a lot of range of motion and stretching to make sure his muscles and his joints stay mobile. There you go. That's the right motion. Good boy. Physical therapy for dogs has blossomed over the last few years. Our typical patients are very similar to orthopedic and neurologic patients in the human world. So I see a lot of sprains and strains. I see post-surgical patients. And it's intriguing with dogs because unlike humans, dogs don't have a right and left brain. So dogs respond faster than humans to physical therapy, and it may have something to do with the simplicity of the brain. They'll try to do almost anything for a good treat. So using treats is critical to rehab, and it's more difficult when you have a dog that is not treat motivated. So I tend to use very high-end or high-value treats so the dog will really work for me.
Good boy.
So if we keep the treat up high, that will shift his weight back onto his back legs. And then you can actually take the treat side to side. So we can strengthen different muscles according to where we put the treat. So some of the challenges of working with a dog is, first of all, they can't talk to you. So we spend a lot of time learning about their signals, and their signal for pain may be simply yawning or starting to breathe a little faster. And for instance, Morgan today was giving me a number of signals about bending his knee. I know, okay, you told me. So the higher they are, the longer she has to spend time on her right leg. Willow had hip surgery where actually the whole head of her femur bone was removed. And let's see how she does over these. Oh, what was that? No hopping allowed.
Physical therapy has been important because I think if she didn't have the physical therapy, she wouldn't be using her leg at all, and it would have wasted away. I wouldn't have known what to do with her post-surgically, to be honest with you. After I had the exercises, it was wonderful to be able to have that, to take home with me and continue to work on her so she can continue with this progress. Come on, Willow, let's go.
Man, Patti, she's so much better. Yay, Willow, good job. So I'm using the laser. If there's some inflammation in this joint, we can reduce that.
Physical therapy for Morgan is essential because for Morgan to be an active dog is really his life. 1, 2, 3, 4, 5, 6, 7.
Good boy, Morgan.
Good boy.
Good
Good
boy.
job.